Thank you, Mr. Chairman, and thank you to all of our witnesses today. On this 11th anniversary of the ACA, I speak as both a pediatrician and a lawmaker when I say, follow the data. Affordable coverage leads to better access to care, which leads to better health outcomes and lower costs, by the way. So I'm thrilled to have my bill, Kids Access to Primary Care, included in this hearing. In my state of Washington, more than 800,000 children access care through Apple Health, our state Medicaid program. And across the country, we know that the provider network for Medicaid patients is really strained. These patients have trouble finding providers who will see them. Physicians cite low reimbursement as the primary reason they are unable to accept additional Medicaid patients. So shoring up this access to care by raising Medicaid reimbursement to match Medicare reimbursement rates will help kids grow up healthier and should play a vital role in reducing the health disparities by reaching underserved populations. So I want to turn to Ms. Mann. In your testimony, you noted that Medicaid access translates into addressing needed care. Can you briefly talk about the importance of access to care and what this means for kids and their future health outcomes, and to address some of my colleagues' concerns about cost of care, what early care for children means for long-term costs to our healthcare system?
I'd be glad to. Thank you for the question, Congresswoman. So while access to care in Medicaid is generally very strong in some areas of the country and for some services, there can be access issues, and in many instances that can be traced back to the payment rates, and particularly for primary care and for primary pediatric care. Unfortunately, the rates can be far too low to be able to sustain the services that children need. Just as important to bringing in more physicians, I would say also the adequacy of that payment level can help provide that platform for a high-performing pediatric primary care system. One that doesn't take 15 minutes to check out a child, but that really explores the developmental development for the child, works with the parent and the child, understands what's going on at home, whether there's hunger issues and other problems that might impair the individual's health. So in many different ways, primary care is a strong platform for being able to care for kids. And as I'm sure you know, it is so important, particularly for young children. Those investments in care for young children, really, there's lots of evidence showing that it will support that child throughout her childhood as well as as she becomes an adult. And that will, in fact, save dollars. And there's certainly lots of evidence about that. Save healthcare dollars, education dollars, juvenile justice dollars, lots of different parts of the system. It is strengthening our systems of care.
Thank you. I want to quickly turn my attention to something my colleague just asked about, which is that access isn't really access if you can't afford premiums or deductibles. And the middle class has really been left out of so many of the subsidies that expanded care to others, many priced out of the marketplace. And that's why the American Rescue Plan offered tax credits and subsidies to cut premiums for nearly all Americans. In fact, 75% of people on the exchange in Washington state will be helped by this. And an additional 25,000 will gain coverage now because they can afford it. And in fact, an average family of 4 in my district will see their premiums drop from about $14,000 a year to $8,500 a year, which is a significant 40% drop. In fact, one of my own patients' families looked at their $17,000 premiums compared to the $1,400 they would have spent just paying cash, and they just went without coverage. And so, Dr. Keith, could you talk about how the provisions for middle-class families will make healthcare more affordable, and how that might also translate to lower costs overall for young families?
Yeah, thank you. And it's exciting to hear that data out of Washington State. So the way that the subsidies will extend for middle income families is no one who's purchasing their own private health insurance will have to spend more than 8.5% of their income towards premiums. It's going to really reduce those costs, as you just suggested, and make coverage much more affordable for people.
Thank you very much. Yield back.